Yeah, so I was following a bit of a mobile clinic, and I wanted to find out, why you started it, and just the services. But before that, what brings you to Paarl? You said you're not from Paarl. You're from somewhere else.
Yes, I'm from somewhere else. I lived in Nelspruit for 20 years. I started off my nursing career there as a midwife with government and did some water deliveries and home deliveries. And then I moved to an HIV project in the Masoy area, which is close to the Kruger Park.
Okay.
And there we worked with HIV patients before ARVs were really available.
Yeah.
And then we started a step-down facility there. Then I went to Iraq in the war.
What?
And
how long were you there?
About 2 months. About 3 months after the war broke out, about 3 hours south of Baghdad in a small little town called Al Shamia. And I worked there with a group of volunteers. After that, I worked...
Wait, but just tell me that experience. I mean, you're not going to meet anybody that was working in Iraq.
Yeah, that was quite incredible, just to be there, to meet the people, incredible people, stuck in time. I mean, the cameras they had, there are those old box cameras where you put that...
Over the camera,
Yes, they had them on the marketplace, and so friendly, the people, unlike any of the other Muslim countries that I visited.
Yeah.
You know, they would come out of the houses and invite you in and then go and find something to slaughter just so that you can stay, so they could have you in their house.
But how's it experience, like a country at war and you're working, or you're like...
I think the people made such a difference. You know, they were so hungry for the outside world to come in after, Saddam just deprived them of so many things. Highly educated people. They were just so excited to have people from the outside come in, that the warmth of the people, against the stark, army vehicles that are burned out and the poverty and everything, it's just incredible, to walk over because we were close to, there was a lot of rice paddies, and so they use the palm trees, the date palms that fall down, they don't cut them down because it's their livelihood, as a bridge.
Yeah.
And it's quite daunting to walk over a tree, and to get to the other side and to visit these families. And I remember this one family had a child with a hydrocephalus, the water inside their brain.
Yeah.
And the medical service there was so appalling. The doctor actually gave the mother a syringe and a needle to draw the water out of the child's head herself.
What?
It was absolutely shocking. I can tell you a lot of stories of the time that I was there, things that I saw that was just incredible. It was such an opportunity to be there.
I can imagine. I mean, for 2 months. Yes. And then after Iraq?
I did all sorts of things all over. I ended up, at old age homes and pharmacies, and then at Salati in Malalan, a sugar factory. Worked there. And then I came down to Paarl.
Okay.
And I worked at government for 10 years, managing 2 of their clinics here in Paarl. JJ Dupree that closed down, and then Klein Drakenstein closed to the tunnel. And then when I left there, and my close friend, who's got the little camper van with me, Beverly, she was the mobile sister for 30 years, and she said, there's such a need for women in the workplace to get their family planning.
Yeah.
Because they have to go on their off day, which is usually, their shifts get worked out for a month, but their family planning date is in 3 months.
Okay.
So then on their off day, they have to go and sit in the clinic the whole day just to get their family planning.
What?
And she said, if we can bring it closer, and that's how this concept was born, to bring a small clinic closer to the workplace, which will actually be a fast line. So it's not a clinic where you go and sit for hours.
Yeah.
It is a clinic where we do small things in a short space of time, closer to where the working person is.
Yeah.
So we started with family planning.
Okay.
Then we added blood pressure and glucose, and because they come in and say, I'm not feeling well.
Yeah.
Maybe their iron levels are low.
Yeah.
Maybe they need to be referred because they need something. Then we added other things. People said, can you syringe ears? Yes, we can do that. So we added that. Can you take out stitch? Yes, we can do that.
Oh, nice, man.
And then in the end, it ended up with also doing COVID testing, because we were testing for expedition medics.
Yeah.
And because you don't need to make an appointment with us. You can just walk in. And all of the other clinics and doctors, you need an appointment.
And also like the fact that you mobile and outside, so you're not sitting in a room waiting.
Yes.
That's why I thought let me check you.
So the nice thing is you can drive by, you can immediately see if there's a queue or not. You don't have to go all the way in. You could just come and ask at the window and say, can you see me? If it's a rainy day, you can sit in the comfort of your car and just come out and go back into your car. If you have a kid that's difficult and crying, it doesn't. If you're afraid that you might be infected by other sick people in a waiting room, you won't be because you're in your car. You can stand outside in the fresh air. So that's how it started. And then we decided to do a little route so that, we can service Southern Paarl and then go to town. We ended up not doing Northern Paarl because there wasn't really such a need at that moment, and we had to make some quick decisions. So we're doing 2 hours in Southern Paarl, and we're doing 3 hours at the game at Waarmarkersplein, and then 3 hours at Rembrandt.
Okay, we're in Southern Paarl. Are you stationed?
Just here between Laborie and Goede Hoop Slaghuis.
Okay, just behind
the butchery.
The wide road.
Yes. But usually the easiest, that's the other thing that makes our concept different, is that, if you want to ask the pharmacist something, you have to go and stand in the queue behind 15 other people. And when you get to the front, she says, no, we don't do that. With us, our numbers are on Facebook and everybody has our numbers saved. So we don't mind. People message us at 9 o'clock at night and say, I've got this rash. Can I come in tomorrow? This is what it looks like. Yes, we can help you, or we know who can help you. I've been trying this cream for so long and it doesn't work. Do you have something else? Do you have a suggestion? We do consultations for very cheap. It's under 100 Rand. And you can, nobody can look at their own throat or in their own ear to know what's wrong. But if you have a diagnosis, a pharmacist can actually give you some drops or some pills that you can decide for yourself.
So how many people are you in the van?
It's just the two of us.
Oh, wow. Okay, cool.
Yes.
So if you think of the services, so I'm ill the morning, I can just come to the mobile van. It's under 100 Rand for consultation.
Yes.
And you can diagnose me with something and give me advice.
If you're really ill and you need 2 days off, I can book you off.
Okay.
And you've got your time in bed and you can go back to work and you feel better. If you need a prescription, I can refer you to a doctor. It'll be very easy for a doctor when you arrive with a letter. He already knows what is your temperature. It's 38. If you have a quinsy abscess on your tonsils, you need to go to casualties and get IV antibiotics. And sometimes people don't know how ill they are because they can't see inside. But you can quickly come in and we can help you. And then you go with your letter. The clinic, even if you go to a clinic, the sister already can see that it's not a patient that they need to see, it's a patient that needs to go to the doctor.
Correct,
and they can make an appointment.
So you're fast-tracking the whole process.
Yes. We also do children. Children has 30 visits up to 5 years. But only about 7 of them, according to the government protocol, needs immunizations. The other 23 is development. Does the child speak? Does he need to be referred to a speech therapist? How's the weight? How's the height? Do they have their vitamin A and their worm medication? So those ones we do.
Okay, you said you started with family planning. Explain to me what is, if I don't know what family planning is, what is it?
So family planning is usually the 2-month or the 3-month injection. Most of the girls know it like the depot or the estrate injection.
Okay.
And then triphasal or Nordet. It's the same that Dischem or Clicks or the government clinics stock.
Okay.
It's the same one.
All right.
So we just realized that the time that you spend at a clinic sitting for that, where with us it's 5 minutes. Our idea initially was that the manager would actually say the girls can quickly go out and just get it and tag each other. But not all of the managers understand it that way. They think the girls are going to not spend. But what happens now is the girls just come on their off days when they come to town shopping anyway.
That is so cool.
Pass by us quickly, get their family planning.
Don't have to do appointment, don't have to take off at work.
Unfortunately, we never ask a man. I always say, we ask a woman, how many children do you have? 3. Oh, don't you think you should go for a sterilization? But we never ask that of men. We never say, how many children do you have? 7. And I was actually joking with a guy one day. I said, how many children do you have? And he said 6. I said, don't you think you should go for a vasectomy? And he was shocked when I asked him that. Because we always ask that of women. The pressure is on them. So just to make that easier for them.
Okay, and you've been just quickly, you've been a nurse for a very long time. How has COVID changed the game? How has it impacted you?
As a clinic?
Just in general, in the nursing environment.
COVID was definitely a game changer because it breaks all the rules. In medicine, we are taught to look at our clinical skills. You cannot just look at a patient and say, cannot just go on a test and say this patient is HIV positive and therefore the patient must get medication.
Okay.
You have to examine the patient and see, does the patient have any signs? Does the patient have an enlarged liver? Does the patient have lymphadenopathy? Does he have glands?
Yeah.
How does the patient chest start?
Yeah.
How does it sound like a pneumonia? Does it sound like a bronchitis? Does it sound like a bronchiolitis? Is it just a... But with COVID, it changed the game because it became a diagnosis only through a test. So if people are tested positive, they are sent home with nothing, no treatment, and that is unusual for us in medicine. They're sent home with nothing, and then when they can breathe, they must go to hospital. I have never seen that in medicine. Unfortunately, this is uncharted waters. So, in medicine and in government, and I suppose in private also to a degree, people follow protocols that are set by the Department of Health.
Yeah.
So if they say this is the protocol, then we have to follow that.
Okay.
Yes, if you're a private clinic or a private GP, you can go outside of that and still, and that's why I like there's a doctor in Natal, Dr. Shankara Chetty, who has treated 7,000 patients in a little tent outside his house, and he didn't even have oxygen, and none of his patients ended up in hospital.
Wow.
And he said because he did much of his training in India because of apartheid, he couldn't do it here.
Yeah.
He could not rely on tests.
Yeah.
You had to look at a patient.
And diagnose,
Yes, examine the patient physically. And, we always complain these days and say the world is so busy.
Yeah.
We hardly get time to actually examine a patient.
Yeah.
So it did change it.
Yeah.
And it does make it difficult because we also don't always know the way forward.
Yeah.
Many times patients come and ask and say, I've got the side effects after COVID. I've got the side effects after the vaccine. And then we're not sure exactly, is it a side effect of COVID? Is it a side effect of the vaccine? How do we treat it? Who do we ask?
Yeah.
Because we're waiting for instructions from the Department of Health.
Okay, and so what is COVID testing with you guys? So you go
So
to
we're doing the
mobile...
antigen test. The antigen test is a rapid test.
Right.
It's not new. It's a 15-minute test.
Yeah.
You get your results within 15 minutes.
Nice.
And you get a little report that you write. It's an approved test by the South African, by SAPRA. So, and you can be off on your way. The problem is, government also does rapid tests, but they only test people that have symptoms.
Yeah.
Unfortunately, the private sector and the marketplace demands that a lot of other people have negative tests.
Yeah.
You can have both your vaccines if you do the Cape Epic, but you still need a negative test.
Oh, I see what you mean.
You can have both your vaccines, but if you are security at the Cape Epic, you still need your certificate to show that you're negative.
Yeah.
And government cannot handle that load of people to come to them. So with us, we can do it.
Yeah. Okay, cool. So where do people find you? How do people get hold of you? What are your social medias?
Facebook page, The Little Clinic.
Paarl. Yeah, The Little Clinic Paarl.
The Little Clinic Paarl. They can find us there. Our numbers are almost on every post that we have there.
Nice, okay.
They can just scroll down.
So Sister Nel and Sister Celia.
Sister Celia.
Right.
They can just message us on WhatsApp.
Okay, and then where locations, fixed days, fixed locations?
It's also on there.
Okay, so where are we? Like in this week, we started yesterday. Where are you today?
So usually we do a 4-day route. So Monday, Tuesday, Wednesday, Thursday. We do 2 hours here in Southern Paarl.
All right.
3 hours at Game.
Right.
3 hours at Rembrandt. Just
Okay,
because there's
cool.
some more people down there. And then on a Friday we do a different route. We do Food Lovers Market.
Okay.
Because the managers there, very nice managers, thought it was a grand idea if we offer that service to their staff.
Okay, nice.
And then from there we go to the Lebombo factory, just because we had arranged with them a long time ago. They pack the fruit for Woolworths.
Yeah.
And then we just do 3 hours inside town. On a Friday, people won't go with something like a rash or even family planning. On Fridays, women want to make sure that things are ready for the weekend.
Yeah.
They need to buy their groceries and things. So we didn't initially add that to our routine. But on Fridays, a lot of people want testing because they're going to visit Oma.
Yeah, okay.
They want to show that she's fine, that they don't, if they've got a sore throat, go and infect her.
All right.
Or they realize they have a wedding and they didn't think about testing before they go, and people said, please test, because there's older people there that's fragile. So,
okay, cool. Thanks so much, sister.
Thank you so much for the opportunity.
Yeah.
And thank you for your initiative.
Yeah.
Paarl is full of beautiful people. And it's just one more reason to stay in Paarl.
Yeah, 100%.
Yes.
Yeah, guys, so that's Sister Nel, the little clinic in Paarl, making medical, what you call it, healthcare services more affordable, more accessible. So, yeah, it's easier for you to go get a sick certificate if you're feeling ill. So we're going to go over to Judith, and she's going to speak to author.